Good evening, everyone, and Happy New Year. I wish you all a successful and healthy year ahead. I wanted to share this quick video to show you a very nice result of our patient, Mr. Batista. He had his hair transplant with us a little over a year ago. I waited until the final photos were completed so you can clearly see the full transformation. Let's take a closer look at the case. The patient was in his early to mid 50s, maybe around 55. So we're not talking about a very young patient. The main issue was a wide forehead and significant recession in the frontal area. We also had mild thinning in the crown area, which we tried to improve during the procedure. Now, regarding the donor area, as you can see, it was actually very good. The hair was long in the photos, but the density and quality were strong enough to provide an excellent number of grafts. I personally like wavy hair because it gives better visual density. From the back, the donor was also strong. If I remember correctly, we extracted a little over 5,000 grafts in total. Let's move directly to the immediate post-operative result. As you can see, we placed high density in the frontal area and then a moderate density across the remaining area. You can also notice the extraction marks in the donor zone. As we always explain, extractions are distributed based on the density and condition of each area. Different specialists have different extraction techniques. Some prefer linear patterns, others prefer more random distribution. The most important thing is that the donor area heals naturally without visible damage. Now, many of you might be thinking the hairline looks high. Yes, that was intentional. There are several reasons for that. First, by keeping the hairline slightly higher, we were able to concentrate more grafts in a smaller area and achieve higher density. Second, we must consider age and facial structure. This patient is in his late 50s, almost 60. A very low hairline would not look natural. His forehead muscles are high and his face is relatively long. So lowering the hairline too much would actually look artificial. Our goal is always natural appearance, not just density. Now let's look at the recovery process. As usual, swelling appears around day 3 or 4 after surgery. You can see some swelling around the eyes. This is completely normal and temporary. It resolves naturally within a few days. Here we are around the end of the 3rd month or early 4th month. The skin color has almost returned to normal. There is minimal redness, maybe 2 to 3%, especially since the patient has a lighter skin tone. Now let's jump to the final result. As you can see, the density is excellent. The appearance is very natural. Even though the hairline is slightly higher, it suits his age and face perfectly. The camera angle can sometimes make the forehead look longer, but in real life, the result looks very balanced. Many people ask me, does transplanted hair grow normally? Yes. As you can see, the hair grows completely normally. It can be cut, styled, and treated like natural hair. Here is a photo from the barber, and you can see how natural it looks. However, I always say something important. No matter how high the density is, transplanted hair will not exactly match the natural density you had at 18 years old. Under strong sunlight, you may still notice a slight visibility of the scalp. Even with high density and long hair, that is completely normal. So if you ever feel that your scalp is slightly visible under sunlight, don't worry. That doesn't mean the result is bad. It's simply realistic expectations. Overall, this is a very nice transformation. He definitely looks several years younger. Write in the comments, how many years younger do you think he looks? Also, can you guess which technique we used in this case? I'd love to hear your opinion in the comments. Again, Happy New Year to everyone. If you have any questions, feel free to leave them below. You can also follow me on Instagram or Facebook. If you're considering a hair transplant in Istanbul, you can contact me directly on WhatsApp for an initial consultation. We can estimate the number of grafts, discuss technique options, density, and hairline design. Final details are always confirmed in person once you arrive. Thank you for watching. I'll see you in the next video.